Dr. Cohen, you mentioned the Cohen saying something, some type of X-ray, some type of three-dimensional thing. Tell us a lot more about that. Why, what, how, and basically what are the benefits for the patient, using that new thing?
We have in our office a machine called an iCat. It is a 3D cone beam CT machine, a dental adaptation of the medical CT. Medical CT machines use a lot of radiation to get pictures. That's one of the reasons that dentistry has kind of got a little bit different route and become much more radiation hygienic by using the type of machine that we use now. Our radiation exposure is really pretty much like what it always had been for the 2 X-rays that we always got. Plus, we can make multiple views using computer-generated programs that can show us things like the jaw joints, can show us things like sinuses, airway dimensions, things that, again, in 2-dimensional X-rays, you can't really see. We can also see root positions. We can look down between teeth. We can cut in between teeth. I have found more pathologic things in the last 2 years since I've had the machine than I did in the other 28 years of doing orthodontics. I really can't believe that I practiced without it.
What are some of those things you found, those pathologic stuff? What are some of those things you found?
On a couple of my adult patients, we found some carotid artery stenosis, things that they didn't even know that could lead to stroke problems. In some of our younger patients, we found extra teeth that were in positions that, with the other X-rays that we used to get, you couldn't see. There are a number of abscess things that we saw on the sides of teeth that, again, with the type of X-rays we used to get, a 2-dimensional picture of everything squished together, you never really revealed the kind of things that we can see in just little slices that we can take now.
Wonderful. Wow. I guess that's pretty heavy and pretty good, a dentist detecting that you might have some artery clog up coming up and do something to avoid a heart attack or stroke.
Yeah, I think that the ear, nose, and throat physicians have found that I'm probably one of their best referrals anymore because I'm noticing things that nobody else has ever sent to them before.
Wow. Absolutely wonderful, absolutely incredible. So that is that new machine. What was that name again?
It's called a cone beam CT. Mm-hmm. Medical machines use a straight line called a fan type X-ray. The dental machine uses a cone beam, means that the X-ray that comes out is cone shaped, so you don't have to have as much exposure to it. It gets it all at one time.
Oh, I see. And it gives you, the real effect is it gives you a 3-dimensional picture, and well, you see a lot more.
Yes, and you can take the head and you can rotate it in any direction that you want. Being able to do that allows us to see things like impacted teeth that we used to not be able to tell exactly where they were located. We know exactly where they're located, whether they're eruptible or not. How many roots a tooth has versus just guessing at it. It really enters into helping us decide the best way to treat our cases, and I think that also has helped in making our treatment go a little bit quicker because we now know the roadblocks we're going to come into instead of finding them later on.
Right. You basically know before you go. You know exactly how it will look like or what it looks like now before you even do it. That's absolutely wonderful. Thanks a lot, Dr. Cohen.